I tried to finish it early. So then you can have some a little bit more rest for prior to the third session. Okay, so now I'm going to share my screen. I hope that you all have downloaded the PDF that I sent yesterday. Can you all see my screen now?
Yes, ma'am.
Okay, so thank you. So this is our fourth lecture under the module Promoting Equality, Diversity and Inclusion. So in today's session, these are our learning objectives. So at the end of today's session, you all will be able to define what is policy and what is procedure, and what are the different policies and procedures which are practicing among commonly in workplace. And these policies and procedures, if we can apply it even for the health and social care sectors as well, but there could be some differences are present. And also we need to identify and explain. So in the previous lectures we studied regarding what is discrimination and what are the anti-discriminative practices and what are the legislations are there in order to prevent the society or the people from the discriminative activities. So here we are going to study what are the effects or the impacts of these discriminative practices, and also why we need to celebrate the diversity. So these are the objectives that I'm going to cover in today's session. So first we'll see what is this policies means. Okay. So policy means it is a set of rules or guidelines for each and every organizations or institutions and employees to follow in order to achieve a specific goal. So that means, so when we talk about any institution or organization, even the organization or institution, it could be a big one or either the small one. So whatever the institution or organization, each and every institutions having a separate rules and guidelines or the rules and regulation which can you, sorry, there is internet connection problem. Uh, so can you able to see the screen now?
Yes.
Okay, so sorry for that internet problem. So yeah, when we talk about the policy, so each and every institution needs to have a separate rules and or the guidelines or the regulation. So these rules and guidelines are not same for each and every organization, because when we talk about the healthcare sector, that means the hospital, the employees and the patients or the caretakers or the employees and the employer are different. And when we are talking about any IT company or when we are talking about any other field, so they are different. So depending on each and every institutions, they are having a separate rules and guidelines. So why we are having these rules and guidelines? Because all the employees and employers who are embodied in that particular institution or the organization needs to follow these rules and regulations in order to achieve a specific goal. So all the organizations and the institutions are having a separate goals. So they are working in order to achieve that goal. So for achieving that goal in an effective and an efficient manner, those organizations are having these rules and guidelines. So that is, we are calling it as a policy. Then we'll see why this policy is important. So as I told, So it is an effective policy should outline what an employee needs to do and no need to do. So yeah, so if there is no any rules or guidelines or regulation, the people who are working in the institutions, they do not know what they need to do in order to achieve the particular goal or in order to enhance their institutional positive outcome. And sometimes if they do not know anything, the activities that are undertaken by the each and every individual who are working in the particular institution may also ended up in the failure. Okay, so in order to get a positive outcome only, this effective policy are each and every institutions are they are imposing. So an effective policy should outline what employees must do or not to do, and directing the people, and what are the limits and what are the principles and guidance for even for the decision making. So with the help of the, so if the employee who is working in a particular institution knows all the limits, principles, guidelines and directions, then they will take a good decisions for the good outcome of the particular institution. Okay, so that is, we are calling it as a policy. So policy is for a employee, how, what they need to do. The questions like what they need to do and when they need to do. Then we will see what is this procedure means. So in order to undertake the policies, so we are having the procedures. So procedure, it is a step and step by instructions for how the policies outlined above are to be achieved. It is the counterpart to a policy. Yes. So no, we are applying a policy like all should come to the office. So for an example, so the employer imposing a policy called all needs to come to the office at sharp at 6 o'clock, 6 a.m. morning. But sometimes when we are applying this policy, we can't achieve the outcome at once because the employees who are coming, there are different kinds of employees are there. Some may coming from the long distance and some are not able to come at the proper time. So there are some problems are there. So we can't achieve any policy at once. So for that, these procedures, so we can have some kind of procedures as a step-by-step instructions we can give, or as a step-by-step instruction we can impose in order to achieve that policy. So first we need the procedure, and that procedure can fulfill the policy, and through the fulfillment of the policy, an institutional goal could be achieved. Okay, so a procedure defines who is expected to do it and how they are expected to do it. So when we are talking about the policy, what they need to do, and when we are talking about the procedure, so how they need to do, and what we are expecting from an individual to do. So this is the difference between policy and the procedure. So when whatever the institution or organization, when we are speaking or talking about institution having a separate policies and procedures. And when we are talking about these policies and procedures, they are not the verbal one. Okay, so all the policies and procedures are formally documented one. That means they are the written document. And why we need to document it written. So whether if we maintain it in a verbal manner, is it okay or not? So why? What is the important for having the formally documented or the written one is it helps to guide the organization's operation and the procedures needed to fulfill the policy. Yes. So think about if it is a verbal one, most of the employees or most of the individual, they may start to forget with the time. Okay. But when we have it as a written document, although the time flies or the time goes, we have some kind of legal document. So we can go through whatever the time. If we missed also, we can take it and we can go through it. So for the future use also we are having. And for the risk assessment. So for the risk assessment means if we are having any policies and procedures, if we have it as a legal document, if there is any risk or if there is any unfavorable condition occurs, then we can have that written document and we can go through it, and an individual can justify according to that written policies and procedures. Why? Because we are having a written evidence. We can show to any people. But if it is a verbal one, none of the person can believe the particular individual, and he or she couldn't justify themselves against the particular risk. And the third one is helps an institution stay consistent when management needs to make decision. Yes, so it can helps to so whatever, so if there is any critical thinking, or if there is any critical situations, and if there is any decision making problem, if we have the formal documented one as same, we can go through it and we can take a proper decision for the development of the particular institution. Why? All the policies and procedures, if they are in a written one, they won't change. Okay, so they are consistent, they are very firm, so we can take any decisions depending on that firm written document. Easy accessibility, yes, so we can accessible easily if we have any printed format. And staff for employee development, yes, so rather than the verbally having these policies and procedures, if we have a formally documented one, each and every staff or the employees in a particular institution, they can go through it for their self development, like staff development or the professionalism. So it would be helpful. So that's why we are having these policies and procedures in a formally written documented one. Okay. So now we'll go to what are the major policies and procedures that are especially focusing in the United Kingdom. So before moving to that,
Excuse me,
are you
sorry.
clear about?
Excuse me, miss. These
Yes,
slides are not changing, miss.
not changing.
Yes, we are in what is the policy still.
Ah, okay, okay. Now can you see my screen? Is it okay now?
Yes.
Okay. So before going to policies and procedures regarding the types, so are you all clear about what is policy and procedure? Do you need further any clarification regarding what is policy and what is procedure? Are you all clear or not?
Here, miss. Please answer others also.
Okay, so thank you. So I'll move to regarding the types of policies and procedures. And in these types, not only these are the types of policies and procedures. So there are different, as I already told you that each and every organization depend on their objectives and goals. They are having separate policies and procedures. So even though they are having specify or the peculiar procedures, there are some common procedures and policies which we can apply to any kind of workplace and even in any set of countries or communities or all over the world. So those are the policies and procedures we are going to see now. So first one is the diversity and inclusion policy. Okay. So the fundamental policy critical to employee engagement. Yes. So we already studied regarding this diversity, inclusion, the importance of diversity and inclusion, and what are the effects and all those things we studied. So so this diversity and inclusion policy, when we are talking this one, it is a very crucial and the critical policy to the employee engagement. So majorly this policy include that ensuring the equitable, diverse and inclusive work environment. Yes, so this policy could be applicable to any kind of workplace.
Miss, excuse me,
Like, yes,
slides are not changing, Miss.
still it's not changing.
Yeah, we are in the that policies and produce.
Okay, then now it's changing, no? So I think I can't go for the slideshow. Is it okay to have the slides like this? Because I think the slideshow is having some technical problem. Is it okay
No,
to have the slides like this? Because I can't go for the slideshow. That's why I'm telling.
Okay, okay, then okay.
Okay, so thank you. So yeah, so when we talk about this diversity and inclusion policy, we can apply to any kind of workplace. Okay, like I like any other private companies, public sector, hospital sectors, or the any other social care sector. So we can apply this. Why? Because when we are talking about this diversity and inclusion, it is commonly seen in all kind of environment. So according to this policy, it is telling that each and every person or the individual who are working in a particular working environment, they should they should be treated equally, and their diversity should be respected. And that means we need to treat them as a unique person, and by considering their uniqueness, we need to include them as a one group. So this policy should ensure that one, like equitable, diverse, and the inclusive work environment. Process for making complaints of discrimination in the workplace. Yes. So normally the discrimination is common. If there is any diversity, then the discrimination is common. So with the diversity and inclusion policy, we can make the complaint. So if we find out any discriminative activities undertaken by a workplace, so with this policy, we can complain, because this policy, they are providing the anti-discriminative activities. Okay, then assessing and monitoring the effectiveness of the policy and working best practices. Yes. So, as I already told you, we already saw in the legislation also. So, it is not enough to impose the any rules or regulations. Once we impose any rules and regulation, it should be needs to monitor. It should needs to evaluate whether it is effective or not, whether it is practiced by the particular group of community or the individual. So why we need to monitor and why we needs to evaluate, then only we can go for further policy making. So like if the first imposing policy is not well, so if the outcome is not good, then we need to alter that policy to find out for the better outcome. So that's why we are monitoring all those things. So similarly, like the legislation here, the policies also, they need to assess and monitor, so whether the imposed policy is good or not. So normally, to remove these discriminative activities, we can have so much kind of policy, each and every institutions, depending on the people they are having and depending on the employee they are engaged in a teamwork, they can have the anti-discriminatory activities. So it is not enough to impose that anti-discriminatory activities through this diversity and inclusion policy. We need to inform to all the people that, so we are having this kind of policy, and according to this policy, if you experience any discrimination in your workplace, you can claim for that or you can complain for that. So likewise, we can assess, we can monitor how they are effective or not. And support and provisions available for differently able people. Yes, so differently able people means disabled people. So I already told you, normally we are not calling them as disabilities, they are differently able people. Yes, so this diversity and inclusion policy not only going for any other diverse characteristics, and also they are providing some supportory activities or the supportory acts for the differently able people also. Why? Because mostly because of their differently able, that means depends on their disability, most of the people are get discriminating in the workplaces. So for supporting that one also, they are having this, we can use this diversity and the inclusion policy. And the next one is recruitment and the selection policy. So when we are talking about any company or not only a company, any kind of job. So normally we are having an interview. We are facing an interview. So if I'm going to be a lecturer, so they are posting an advertisement regarding the post. So when I applied, then they will have a interview. It can be a face-to-face interview or it can be a walking. That means a face-to-face interview means it can be either walking interview or it can be either virtual interview. So however, they are having an interview. Okay. So before the interview, in some job criteria, vacant criteria, they have listed like shortlisted candidates, shortlisting. So shortlisting means so normally in the advertisement, they are providing some criteria or the qualifications they are expecting from a particular candidate. So all the applicants can apply, but the most suitable candidates they are selecting. Okay, so that is shortlisting. They are shortlisting who are the people they are most compatible for that particular vacant. And after that, they are finally going for the interview. And in the interview, they can find out who is most appropriate for that particular position. So this is the normal way. That means this is the equality way of providing opportunities and chances for any individual. But still there are some problems, like if the people who are very if the like recommendation, some people they getting the job by the recommendations with the help of, if the people have any closed contacts or if they have any recommended people for that particular job, with that recommendations they are getting. So in that situation, the employer, they are not seeing the ability and the qualities of the candidates. So they are only focusing regarding the particular patient's recommendations only. Still, there are these kind of discriminative activities are going on. So to resolve all these discriminative activities, so this policy will be held. So recruitment and the selection policy. So we'll see what are the components of this policy. Individuals will be selected on the basis of their merits and abilities through an open and transparent selection process. Yes, so whatever the institution, so all the candidates should be selected based on their merits and abilities, what their qualification is. And it should be open and transparent to the selection process. That means normally when we talking about any interview, so that particular institution may have the higher authority people like chairperson, 2 or 3 persons. So when we are facing an interview, we are not normally having one person interview. Okay, so it is like a panel. We are telling it as a panel, or 2 or 3 people are there. They are interviewing us and they are having some questions and asking. All those things will be happens in an interview. So all those things, that means not one person can select the particular person. That means if the person is having any recommendations, not he can't take the whole decision. Okay, if he's going to select that particular person, he needs to tell what are the good qualities and why he is choosing that particular individual for that position to other panel members as well. So that is, it is an open and the transparent selection process. All vacant positions will be advertised internally and or externally in the relevant media. Yes, so there are some institutions, like when we are talking about the university sites, so there are some faculties which they are recruiting the lecturers or demonstrators internally. That means they are not advertising or they are not advertising regarding the vacancy for the academic vacancy externally. So they are normally circulating all the academic vacancies among their faculties or among the universities. So the people who are graduated from that particular faculty, they can apply for the post. Okay, but there are some universities, they are applying or they are posting an advertisement and they are asking and they are willing to get the people from other external university as well. But however, they needs to mention how many vacant positions are there. So normally when we are talking about the interviews, it's common in the advertisement they are putting there is one vacant available, or there are two positions for like research assistants, or there are two academic vacancy, one for demonstrators, senior lecturers. Likewise, they are mentioning the vacant position, and it is must. Then only the candidates know. So it is a kind of giving fair opportunities. Then only each and every candidates uh, they will know that how many positions are there, and they can claim as well. Like if they not advertising the vacant positions, the candidates who are coming for the interview, they are not aware how they are recruiting. Okay, so if there is having any recommendations, then they may have, although there are two vacant positions, if the recommendation is there, they may take only one person, so others may won't get the opportunity. So that is the importance of advertising the vacant position as well. And person specifications will only need to perform duties and responsibilities of the post where there is a genuine occupational requirement, which is justified in accordance with the provision of the Equality Act 2010. So regarding this person specification, so I am not aware about other job interviews, but especially normally when we are talking about the foreign academic vacancy, like if I'm going to apply for any foreign universities as a lecturer or any other demonstrators, so they are asking a special part called personal specifications. So normally in the personal specification means we need to specify, so each and every individual, the applicant, so they needs to write like para. So they are asking for 300 words or 500 words, like they are mentioning. So they are asking that each and every vacant, that means applicant, they needs to specify what are his or her abilities, and whether they are suit for this position or not. What are their capabilities? What are their experiences in the relevant field? Likewise, they are asking regarding the person specifications. So when we are talking about the Sri Lankan setup, also we are having, but normally we are applying a CV. So that means in the CV we are making that experience, all those things. And sometimes they are having a separate application forms. So in that application forms, they are having a separate columns like our high education, our qualification, whether I have demonstrated previous or I have any knowledge or experience in the academic field, and the time period, durations, or likewise they are asking. So these are, we are calling that as a person specification. So why these person specifications we are mainly asking, the thing is, then only we can, so by reading the person specifications, we can identify the uniqueness. That means the unique ability of the particular person, whether he can be suited or not. Because when we are talking about the interview, so like so many applications they will receive, so it is also kind of easy for the recruitment of the process. Okay, so that's why we are asking this person specifications. But sometimes in this person specifications, if they have normally, if the vacancy is internal vacancy, that means they are requiring the candidates internally. So if they find out that person specifications, normally we are writing our name and all those things. No? So with that person's that things they can neglect, or if they have any personal vengeance in the particular institution, so they can neglect the particular person, although he or she is having a good ability, and if although they are suited for the particular job. But so the thing, so the reason for the person specification is only for requiring the person whether they are very suitable or not. But sometimes they are misusing that also. That's why they have to, so mainly, but with this requirement and selection policy, a person can justify also, and this justification also presented in our Equality Act 2010. Why? So this Equality Act, we already studied regarding the equal opportunities and all those things. So this Equality Act as a components, we can justify if any person having any discriminatory opportunities regarding this person specifications. So the next one is where employees have needs which may require adjustment to existing workplace practices. Considerations will be given to whether or not it is reasonably practicable to vary or adapt. So this means, so normally the policy and the procedures, it also could be vary according to the employees' suggestions. And if their suggestions are reasonable only, we can change. Like normally we can take as a dress code. Okay, so not all the people can wear a same dress code policy which is imposed by every institutions. So if the particular individual is providing any suggestions or complaints regarding the dress code, and if it is reasonable, if the justifications that are provided by the particular employees reasonable, then they can included under the institutional policy. Okay, so when we are recruiting, and we can include this practice into the institutional normal routine institutional practices also. Candidates will be assessed only against clearly identified requirements for the job to avoid judgments on the basis of assumptions, prejudice, or stereotypes per the shortlisting process. Yes, so here normally this shortlisting only having that assumption. So normally due to so that's why we are having. So all the candidates will be assessed only against clearly identified requirements for the job. So that's why this person specifications, or normally they are asking a detailed CV. Why? When they are shortlisting, so by seeing the CV, they can have some kind of assumptions. Okay, that means sometimes the person CV may tell that the person is a very capable and a very good talented one, but actually in actual setups, when it comes to the normal work setup, he is not that much talented or critical thinking, but we can write whatever we want in the CV. So normally we are not cross checking now. So the things that we are included in the CV, the employers, they are thinking, yeah, it's a good one. But when after they included into the workplace, and after seeing their job capabilities only, they will come to know this person is not fit for the job. So not only reading the CV and all those person specifications, we need to have a, that means the shortlisting is also good, but the thing is rather than shortlisting, that means we can shortlist the people, but we need to include all the people who are applied, because sometimes their CV is not good, but actual thing, when we are talking about the work setups, they are very talented person, but with the, that's why we can't come to any assumptions or prejudice, or we can't do any stereotypes by having that person specification also. But so the CV and all the person specifications, that means the shortlisting process, it is having both the good and the bad way. So the next one is positive action does not allow an employer to appoint a less suitable candidate just because that candidate has a protected characteristic that is underrepresented or disadvantaged. Yes, this is another important one that is normally used in each and every institutions, these protected characteristics. So most of the times, depending on these protected characteristics, most of the peoples are discriminating or neglecting from the particular job position, although they are having abilities and skills, but all those things should needs to be stopped. Okay, so we can't neglect any individual because of the protected characteristics, because that characteristic won't do anything in their related relevant field. So their knowledge and their power and their strength are the important one. So these are the major components are included regarding this requirement and the selection policy. So this policy also could be applicable to any kind of working environment. So the third one is dignity at work policy. So dignity at work policy means regarding the bullying and harassment, dignity, respect at the work policy. Yes, so whether it is an employee or the co-worker or the employer, each and everyone who are engaged in a particular institutions should needs to be treated with respect, with dignity. Although he is an employee, the employer can't bully or can't harass. So because the employee also a human. Okay, so he also having a peculiar respect, personal uniqueness. So we need to respect all those things. Preventing and tackling inappropriate behavior and conduct is essential to ensuring that NHS resolution is well managed and well led, and it is committed to continually working toward achieving a culture where bullying and harassment are out of peace. So yes, so this dignity at work policy especially helps. So normally they are mainly following in the United Kingdom. So according to this dignity and work policy, so the any person who are working, even the minor employer or the minor employee or the major employee, they can prevent and the tackling inappropriate behaviors which they are experiencing from the higher authority or the co-worker. So, so they can we can prevent those harassment and bullying. This policy reinforces bullying and harassment at work is unacceptable, and that NHS resolution committed to provide a working environment which is free from harassment, intimidation and all forms of behavior which are unacceptable and offensive. Yes, it is not only for the United Kingdom, but when we talk about all over the world and any kind of community and workplace, it is must. So each and every working environment should be free of harassment, free of bullying. Okay, and it should be in a favorable manner. So, or the working environment should be favorable for each and every individual. And also, we can't have any offensive and any unacceptable behaviors. So, all these harassment and bullying, not only by the physical harassment, it could be a verbal harassment and it could be a emotional harassment. So all those things needs to be stopped. So the working environment should be very, very peace, calm, and it should be very, very pleasant for each and every employee. Then only they can work freely without having any depression or without having any tension and stress. So if the employees work in a good manner only, they can achieve a particular goal. Okay, so these are the things needs to be maintained or needs to be focused when an employer providing a working environment. So mainly, so simply we can say, so according to this policy, we need to provide respect to each and every individual. The fourth one is a flexible working policy. So it's also similar to the dignity. That means the working environment should be flexible. So any individual. So that means the employer can't restrict any person. That means the employer can't stress or the employer can't rush the employee to finish the works like within 2 days or 3 days. If the work can be carried out for 1 week work, then we need to provide a space for the employer to finish it off 1 week. But when we are talking in some institutions to achieve a particular goal, so to fulfill their achievement, they are rushing the people. That means one person needs to do 3% works and it should be completed within 2 days. Likewise, they are providing a target. So to completing the targets, but it is not good. Why? If when we are stressing the person's individual, no one can work in such a stressful manner. So the employer needs to provide a flexible environment. So the employer can, if the individual is working for a whole week from 7 to 4 or 8 to 5 like that, then they can provide 2 weeks, 2 day off, or in a particular week, they can provide 2 day off. or if they works continuously morning and night, like when we are talking about the hospital setups like private hospitals. So when we are working day and night shift, they are providing a work day off. So if there is a night shift, normally in the hospital setups, so in a week, that means in a month, they can have 4 night duties like that. If they are working day and night, and they needs to provide a day off, because working day and night like 18 hours, if we are working 18 hours in a hospital setup, definitely we need to take a rest for the next day. But in sometimes they are providing 18 hours work like day and night for 2 or 3 days if the situation is very stressful. But normally when we are talking about the healthcare sector, it is we can't do anything, because like pandemic, and for the survival of the other survival of the community, we need to do that. But when we are talking about other companies like private sectors, they are also to complete the target, the employers are rushing the employees. And if they rush the employees, the particular individual may have stress, and also they won't have any good time with the family, and then the family problem also come. So altogether the person's health will get affected. Okay, so finally there is no any good outcome for the particular employee. But the employer, they will have all the luxury life and all those things, but the employee, they are not having they are having both physical, mental, economical, social, family, all the problems will affect them. So it is important. But so through this flexible working policy, you can claim if you are having any disadvantageous working environment, or if your working environment is not flexible. So this flexible working policy, you can claim it, because each and every institutions needs to have this flexible working policy as well. So many so mainly helping for those with family and personal needs thrive with the constraints of fixed working hours and an ability to work away from the office. Yeah, it's also so the working. So the without having a working without having a flexible working policy, definitely in addition to the health issues, they having some family problem as well. So why sometimes if most of the people, they are working from not in their hometown. Yeah, it's not all the persons can't get that opportunity to working in their own hometown, or with their own family members, so they need to go for any other places for the working. Okay, so sometimes due to this rushing of the in work, they may have not returned to the home for 2 or 3 months like that. So in my case, I'm also working away from my hometown. And when talking about the university setup, so we are having several exams and for several batches. So normally we are having 4 batches like that. We are having exams and we are having clinical posting. So as a academic instructor, I need to, we all the academic instructors, we need to go for seeing the posting and exam duty. So I think nearly 1 or 2 months I didn't go to my house. So both the tension, and also we are not having good time, we are not spending our enough time with our family members, so all the problems will come. So each and institutions needs to have a flexible working policy. Uh, but there are some situations where we can't expect all those things as well in order to fulfill our particular job. But if there is a way, then we can provide that in a good way. So this is regarding the flexible working policy. So fifth one is a work-life policy. So what is this work-life policy means? So should encompass parental, shared parental, adoption, surrogacy, and family-friendly leave and support employees who are transitioning. So yes, so normally in some institutions, they are having like example, several institutions recently begun to introduce new policy for offering additional support for employees who have experienced miscarriages. Miscarriages means abortions. Yeah, so I think I'm not sure whether we are having these policies in our working environment, that Yeah, so miscarriage, abortions mean, so we need to provide some kind of flexible environment or some kind of peaceful working environment for a particular individual when compared to other people. And also if the mother, so he's a single parent, when we are talking about the single parents, and if she is the one. Can you all see my screen now? Hello, can you see my screen?
Yes, ma'am.
Yes, work-life policy.
Okay. Okay. So yeah, like, so if we are talking about the single parent, especially single mothers, so they need to look after their child as well as they need to fulfill, they need to come for the work as well. So in that situations, other co-workers, they can provide some kind of allocations for in by understanding their workload, and we can, the co-workers, they also can help. So that is work-life policies. But I'm not sure whether they are in each and every institutions they are having, but we can, that means we can reduce the working hours or for that single parent mother when compared to others. And but the thing is, so when the institution is providing those kind of allocations, the other people who are having, the other people, they start to blame. So why she is going early, and why she is coming late, and why she is having all those allowances and allocations like this. The thing is, it's natural. Normally, we are not understanding the situation. We are not recognizing the situations, but we are comparing why she is having like that and why we are not having. But once we start to understand the situations, then the working environment also become a pleasant environment. So this is regarding the work-life policy. And the next code of conduct. So we already studied regarding what in our previous first lectures also, what is this code of conduct and what are the importance of this code of conduct. So the code of conduct, it is essentially a set out how the organization expects its employees to behave in the workplace. Yes, so each and every organizational authorities, they are having some expectations. That means they are having how they employees needs to work, and how they needs to provide, how they needs to work, and how they needs to do the activities in order to get the positive outcome. Those things they are expecting, each and every institutional authorities. So for expectations, to fulfill those expectations, normally any new individual coming to the particular institutions doesn't know how the employer expecting to work by themselves. So in order to provide a clear clarifications only, we are having each and every institution having another kind of policy called this code of conduct. It is a set of rule, we can call it as a rule, so it can be a principle, so it can be a list of indices which each and every employee needs to understand, and they needs to know what are the expectations and what they how they can fulfill their expectations. The policy
According
should detail. Yes.
to sta-
The policy should detail the standard of professionalism expected, such as appearance or dress code, corruptions and anti-bribery, employee benefits, and expectations of open and honest communication from all. Yes, all these code of conduct are like they are mainly important for improving the professionalism of each and every individual. Also, they are including complying the requirements such as health and safety and environmental laws as well. So simply this code of conduct means it is a set of indications or the indices which are which needs to followed by each and every individuals in order to improve their professionalism as well as improve the organizational outcome as well. And also they also indicating the health and safety measures and also the environmental laws that needs to be followed by each and every institutions. So this is regarding the code of conduct. And the next one is a disability or the differently abled and reasonable adjustment policy. Yes, so as I already told you, if the person is having disability, we can't neglect any person from the particular job. And that is also if the person is like we need to first we need to see whether the person can suit to that particular position, although he or she is having the disability. So when we are talking about the nurses, so it is so if an individual is a wheelchair bounded person, we can't select for that particular person for the nursing job. Why? Because normally the nurses, they can't stay in one place. They need to walk and they need to do all the works. And if there is an emergency, they need to go and do all the things. So if the wheelchair bound person, it's difficult for that particular person to do that. So normally it's common. So prior to selecting the nursing people for the education, for the nursing education, we are having, they are normally indicating the criteria. So the peoples who are, that means disabled peoples are not come, that means mentally lack capacity people also we can't, they are not including. And also even they are checking the height also, they are mentioning. So the nurses, the minimum height should be 5 feet and 3 inches. So the people who are coming for the applying for the nursing education, they should be above 5 feet and the 3 inches. Okay, so likewise, they are having a separate criteria. But if the person is a software engineer, so it is not the thing. Okay, so although the person is a wheelchair bound person, he can work or he can work it as a software engineer. So likewise, so we are telling that we can't discriminate the person by addressing the disability, but we need to we need to cross check the position as well. So the position that he or she is applying is suitable with that disability or not. Okay, so there is this kind of point is also there. So you can't tell that they are discriminating the disabled person, they are neglecting, not taking the nursing education because he is a wheelchair bounded. But why? There is a rationale is also there. Okay, so we need to see the both the sides. So detail how the organization will make adjustments to adequate support and accessibility for the disabled. Yes. So normally, most of the institutions, they needs to have, like, I'm not telling about the healthcare sectors, if any other working environment, so they can have some kind of adjustment to support for this, the accessibility for the disabled people who are working in the particular environment. Like they can have both the lift in addition to the staircase for the transporting purposes, like from one building to another building. And they can have the floors, it should not be very slippery. And also they can have some, that means if the person is having any long sight vision problem, they can use, like, they can change the font sizes and all those things. So those some changes or the adjustments they can provide in order to enhance the work fulfillment of the disabled people. This could mean making adaptations to the workplace, purchasing specialized equipment, flexible working arrangements, and additional support. And also in addition to making adjustments like changing the equipments, changing the physical barriers and all those things, the co-workers, the people who are working along with that disabled person, they also need to provide some kind of emotional support, and they should be friendly. They can't point out, or they can't corner that particular individual uh, by addressing the disability of the person. Okay, so they can have that they also can treat that particular individual as a one group. They can include them in their teamwork, then only that person can develop some kind of self-esteem, self-empowerment. Okay, so this is also, so in addition to the physical, adjusting the physical barriers, it is also important to providing the emotional support as well. So this policy also considered hidden disabilities, learning disabilities, and reasonable adjustment and support needed for the affected individual. So so according to this policy, so normally they are also providing a kind of support for the disability people as well. So by this policy, we can include the disability people into the institution, and they also can have some kind of good future life as well. So the next policy is trans inclusion policy. So trans inclusion policy mainly emphasizing the equality of transgender. That means we already studied regarding this as well. So no need to look at what the gender of the person is. So we need to include uh, without any hesitation. Even if the person is having very talented one, then we can include it. So this is trans inclusion policy, which is mainly emphasizing for the transsexual or the transgender people. And the next one is mental health, well-being, and the menopause policy. So mental health, well-being, and menopause policy, it is this institution ensures a safe workplace and its commitment to staff safety. So normally it is, so according to this policy, it ensures the health and safety of each and every staff who is working in the particular institution. Their well-being, they are mainly ensuring the well-being of the or the wealth of the each and every individual. Helpful to include the details of the resources and support available to the employees. Also includes the policies to support women managing the symptoms of the menopause in the workplace. Yes, so menopause means, so after, so normally, so women's, we are having that menstrual period like menarche. Okay, so menarche, so each and every month, so it is a normal biological process which each and every woman experiencing in their lifetime in order to prepare their body for the birth of the baby. That means for the uh, delivery and the birth. So, but we are normally after 40 or 55 years, it's also natural. So this menarche or the menstrual period, it stops naturally. So the period after the stoppage of the menstrual, we are calling it as a menopause. So once the women reach the menopause, they may have several physical problems, like they may have bone, the development of the bones may have get collapsed, okay, like osteoporosis and some infections. So those infections may especially affecting the bone. So if they affect the bones, they may difficulty in walking, or they are unable to bear the heavy weights and they can't walk, all those things. And also after menopause also, the stress, depression, they also increase. So all those things, why? Due to the hormonal changes after the stoppage of the menstrual period. So the people who are experiencing the menopause, they may so they can't tell. So if the person is frustrated, and if they are very depressed and stressed, and if the employer or the institution increases the workload further, so definitely their health and the emotional, mental, and the physical health all will get collapsed and affected. So each and every institution should have like menopause policy as well. So menopause policy means they can have some uh, the stress and the workload provided to those kind of women, it can be reduced. Okay, so they can provide some peace and calm environment. And if they are having any walking problems like bone problems, and we can restrict the persons to wear the heavy weights like that, we can have some adjustments and the modifications for helping for those kind of people. Then only they also can happily work in the particular environment. This should address flexible and hybrid working mode. Yes, hybrid working mode means both the virtual, like work from home, and that means for a per week, they can come to the office for 2 days, and other days like work from homes, they can provide like that. and they can train for the managers, guidance on where to source additional healthcare information and providing the feedback. So these are regarding the mental health, well-being and the menopause policy. So these are the most common or the major policies that could be followed in any kind of work environment. Okay, in addition to this, there are different policies also there. So are you all clear up to now regarding the major types of policies and procedures? Or do you need further any clarification? If you have any doubts, you can ask. Up to now, if you have any doubts. Shall I move or do you need further clarification?
You can move.
Okay. So thank you. So next we'll move to caring for transgender patients in health and social care. So these transgender and the disability. So these are the major two characteristics that we are normally discriminating. Okay. Although the age, socio-economic status, pregnancy, marital status are there, but the importance that we are giving for the transgender and the disability discrimination are common. Okay, so now we'll see how can we care the transgender patients in health and social care according to the some policies and the procedures. So first we'll see what are the policies and procedures like visitation right, same-sex domestic partners as well as friends. Yes, so we can have, so if the transgender patient is admitted to the ward, so the patient, so visitation rights means sometimes if the patient is a transgender, the people who are visiting for that particular individual is also could be a transgender. Okay, so as he is a transgender, you can't allow you can't say that you are not allowed to see that particular individual. Okay, so there are policies and procedures. Any people can visit. So whether it is irrespective of age or gender, if the patient is admitted to the ward and if a person is telling that he is a relative or if the person is any a partner or something, then they have the rights to visit and see the condition of that particular patient. Okay, this is the visitation rights. Patient non-discrimination. So yes, another one is you can't discriminate the patient depending on their sexual orientation, gender expression or the gender identity. That means as the individual is a transgender, you can't say there is no any guide rules or regulation are there that a transgender can't admitted to any wards or the transgender can't get any health and medical activities or the medical services from both the public or the private sector. There is no any rules and regulation. They are also human beings and they are also living in a community. They also can enjoy all the services which are provided by the nation, and also they are also can they are also coming under all the legislations which are imposed by the government. So for that you can't discriminate as by pointing out their protected characteristics. Names and pronouns. So names and pronouns mean, so mostly some of the people they can have. So like normally, so transgender means you all know. So male can change into female or female can change into male. So if you find out a transgender like male changed into female, so you can't call the name like Mr. or Missy. So if the male changed into female, you can't call it as Mr. like that. Okay, so that means you need to ask from that particular patient what is your preferred name or what is your choice of name, or the pronouns like Mr., Miss, or Mrs. So those are the pronouns. Okay. And names, so they may have different kinds. So at birth they will have one name, but after they changed into a transsexual, the some most of the people, they are changing their birth name as well. Okay. So you can't, so if you need to call them, you can ask from them what is the name and what your name of choice, how can I call you, like that you can ask, and you need to call them, and if you need to call them by that name only. You can't take any decision and you can't call whatever the name or whatever the pronoun that you think. Okay, so there is no any rules and regulation. So the patient's preferred gender should be respected and the patient should be addressed by their name and pronoun of choice. Next one is staff behavior. Yes, so the behavior of the staff. So you need to provide respect. The transgender person is also a human. They also having their respect, dignity, and all privacy, all those things. And also they are having their separate culture as well. So the transgenders, they are following a separate culture. So you can't degrade their culture, you can't degrade their norms or beliefs, you can't corner them by having that culture and all those things. Okay. So the behavior, so the staff or nurses, physiotherapists, doctors, consultants, whoever the healthcare professionals. So how you are providing the, so you need to provide the care for the transgender person similar to how you are providing the care for a male or the female patients. So irrespective of their culture, gender, age, you need to provide the same care and your behavior should be same. Okay. Room assignments. Room assignments to be based on the patient's current gender identity. Yes, so normally room assignments means when we are talking about the ward, so there are female wards are there, male wards are there. Some wards they are having both males and females, but they are having separate cubicles, like males are in one cubicle, females are in one cubicle, and there are different male surgical ward, female medical wards, like different separate wards are there. So once you encounter a transgender person, so you need to give the preference for the current gender. So if the person is previously male and now if he transferred into the female, then the preference should be given to the current gender. That means that means she needs to admitted to the female wards. Or if the person is before female and now male, then he needs to transfer to the male ward only. There is no any separate ward, so you can't allocate them separately. Okay, so you need to allocate. So they are also a patients. Okay, so you need to think as a patients only. You can't think they are having this kind of gender or they are having this kind of culture. Okay, as a healthcare professionals, you need to think they are patients and you needs to we needs to help for the survival of that particular patient. Administration prohibits employee to employee discrimination or harassment. Yes. Then the administration, it should prohibit. The administration shouldn't have any kind of rules or regulations for the employee harassment and this based on the sexual orientation and the gender identity. So these are some of the the policies and procedures that you need to follow up when caring the transsexual people as a patients in the health and social care settings. And what you can do if you encounter any transgender patients, what you can do for them. So you need to try and greet that patients generically like other patients. You need to treat them, you need to respect them and greet them and welcome them presently. Ask the individuals what name and pronoun they would like to use. So don't use whatever the names and pronouns you like. You can ask like how hello, how can I call you, or can you tell your good name please, like that you can very politely you need to ask. You can't ask like tell your name in an arrogant way. Okay, how you are asking from the other patient, similarly you need to ask from them as well. Apologize if you accidentally use the wrong name or pronoun for an individual. Yes, you need to apologize. It is okay if you, because accidentally you can mistakenly you can call them in a any other name. So if it's so direct, and if it's so, immediately you apologize. Sorry, it is, I am not tell it intently. So it happens accidentally. So forgive me, like that. You need to tell it in a polite manner. Allow individual to use the restroom that corresponds with their current gender identity. Yes. So there is no any separate restroom for the transgender people. Okay. So this is the this is the commonest problem, the transgender people. Not only this one, so the transgender people, they are having and they are suffering lot of problems to survive in this common community. Okay, so the thing is, we need to identify and we need to understand their emotional sufferings and all those things, and we need to provide respect for those emotional things as well, because it's a natural phenomenon happens in their body and they are not the responsible one as well. So this restroom, so you can't say, you can't say that you are not allowed to use the female bathroom or male bathroom like that, because we are not having any separate transgender bathroom also. So you need to provide respect for the current gender identity. If the person is now female, then she also having the rights to use the female restrooms or the washrooms as well. So these are the things you need as a healthcare professionals. You can't encourage, you need to encourage these things for other healthcare professionals and other co-workers and other patients who are admitted to the same wards. If one person can encourage these kind of things only, others also can start to follow. So as a staff, you are the one first need to improve all those things. So these you can do, but there are some things what you cannot do. Okay, so those things you cannot do. Avoid using honorifics or the gender terms, like no need to use like sir, Mr., Miss or Mrs., because it may hurt that person as well. Also, you also needs to you also may need to address mistakenly. So to avoid that, you can just greet hello, how are you? No need to tell answer good morning like that. You can tell hello, good morning, how are you feeling, how can I help you? Likewise, you can tell. It's also a kind of respectful and a polite way of asking, talk, communicating. Don't refuse to address an individual by their preferred name and simply because it doesn't match their appearance. Yes. So if the person is telling any name and if the person is likes to call by their name, there is no point of addressing and no point of accusing all those things. If they are liked to call by that name, then you also can start to call by that name. There is no any loss for you if you call by that name to that particular individual. Don't suggest to a transgender person to use an all-gender restroom to appease a complaint from another individual. Suggest to the complainant and that they can use all-gender restroom if they feel more comfortable. Yes. So normally in the hospital setup, so if this transgender person is using a female restroom and if any other female patients coming and complain to you, so you can't tell the transgender patient to use the common restroom. It is not the good way. So rather than that, you can educate or you can teach the complainant to understand the situation. So yes, the transgender person, they can use the common restroom once if they feel comfortable, if they're willing to use the common restroom or if they're comfortable to use that common washroom or the restroom, yes, they can use. Otherwise, you can't force them to use that common restroom. So if any complaints from other uh, patients you receive, don't encourage those things in don't encourage. So as a substitute, you can suggest and you can educate those people who are having those kind of think or the those kind of thoughts. So you can educate them. Don't ask an individual to provide more information or photo or legal identification in order to address them by their preferred name. Yes, so don't ask those things. So if the person is telling my name is this and I'm coming from like, then it's okay. Okay. So don't ask their photos or legal identification for the further. These are not the good thing. As a healthcare professionals, you are not, it's not good to follow all those things. Okay, because all the things will be hurt the patient. So our concern, so you need to, as a healthcare professionals, you need to focus, they are patients and you are the people who are providing a healthcare. So whatever their gender or whatever their background and what, they are not the case. Okay. So these are the things you can't do when caring for the transgender patients. Now we'll see regarding caring for the differently able patients. Now we can see how we can caring for the differently able patients in the health and social care setting. So these are some of the policies and procedures, like if the person is a blind person or the low vision, deaf or hard of hearing, then the communication should be effective. Okay. So if the person is a blind person, then you can use the Braille method. Okay. And if the person is a deaf person, and you can have any other hearing aids for the effective communication. Or in addition to this, you can use a sign language. If the person is a deaf, and you can use a sign language. Or if the person can't talk, you can use a sign languages like verbal. So if the person is a blind, there is no point of having a written document. So if the patient is blind and you need to, as a nurse, you need to take a consent from that particular patient, you can explain the procedures, all the things verbally. Okay. So there is no need to have a written document, and there is no point of giving the written consent form as well. So the communication should be effective. Patient complaints or grievances. So ensuring responses of complaints or grievances expressed by patient. Yes, so patient. So most of these patients may have some grievances. Grievances means, so it's a kind of a rough behavior or the rude behavior. So they are not actually having that behavior, but the depression and the frustration made them to behave like that. So patients may complain. So patients may grievance. Okay. So or normally the patients who are admitted to the ward, they are having some kind of stress and frustration, and they are not emotionally stable. So providing the complaints by the patient, friends, family members related to the treatment options or the investigation is common. And when we are talking about these disability persons, when compared to other patients, they are having some kind of more in this. So if they are providing any complaints, don't take it personally. Okay. So it is common because they are suffering a lot. Okay. So don't take it personally, and try to provide a good care for them. ICU visitors, yes. ICU means intensive care unit. Normally, we are admitting the very critically ill patients to the ICU. And also, we are not allowing all the people to enter into the ICU because it is very sterile and very hygienic. And we are having a separate, even we can't wear our normal shoes and normal clothes when entering to the ICU, because it can, those people are can get infections and can get any kind of germs quickly. So to prevent that only, we are having a separate protocols for that. So if so normally we are having, sometimes we are allowing any by family members, one family member or friends to accompany that particular ICU patient. So if it is so, you can provide accommodations for the visitors. Why? Because that person is also needs to have some kind of rest. So normally in the private hospital setups, not in the government hospitals, even in Sri Lanka, some private hospital setups, they are having these accommodations for the visitors as well, but I think they need to pay. It's as it is a private hospital, they needs to pay, but they are having an accommodation for the visitors as well. Then regarding emergency evacuations, yes. So if there is any emergency condition occurs, especially if the disability person caught it get caught in any emergency situations, so we need to evacuate them immediately. So if the building get burn, or if get fire, it get fire, then so in addition to the steps, we can go through the lift, like those things, so we can have any alternative factors for the disability persons. Okay, and we need to accompany them. If the deaf person, then they can't hear any alarm sound, so we need to accompany them. And if it is a blind person also, they can't see anything, and so if the person can't talk, if although they can hear and they can see, but they can't express it. So in that situations, we need to immediately, first we need to evacuate and provide a safety for the patients, visitors, and other personals during the emergency situation. General accessibility policy regarding accessible facilities equipments. Yes, we need to inform to the disability persons that we are having these kind of equipments, and you can use these kind of walking aids, or the other, like if the person is a that like the person can't talk, then we can have interpreters, or we can have a translators, or we are having hearing equipments, or we are having glasses, like that. You can instruct the patient. So we are having these kind of equipments, and you can also can afford it, and you also can access it. And also we are having different and also we are having different services, programs, like we need to instruct them, then only they can have an accessible for them. Okay, like other patients as well. Patient assessment and reassessment, meeting patient's needs as well as patient needs as they change in response to care. Yes, so patient assessment and reassessment, it is common to other patients as well. So you need to assess the patients, what are their needs, and you need to change their treatment options and the other management options according to the needs of patients. So by that only we can improve the health of the people. So these are some of the policies and procedures which we are focusing mainly in the health and social care settings when talking about the disability patients. So here, so we have already studied regarding the inclusion. So here I have displayed two pictures regarding the inclusive behavior. So here how you can be an inclusive in an environment. So or both in a health sector and other environment, how you can be an inclusive person. So here some of the tips, and like here you can see, so how the inclusive behavior. So you should be self-aware. Okay, you should be self-aware, then only you can be in a, so if you are not self-aware, then you can't work inclusively in a particular team. Then it should be fair, your activities, your judgments, your suggestions should be fair to all the members you are working with, and you should be courage. Okay, you need to be very firm in your decisions. You should be courage to take any decisions, any actions, and you should be adaptable. Yes, so although you are having different kinds of things, and although you are having different kinds of attitudes and behaviors, but you need to be adapt yourself uh, once you entered in a particular teamwork. Curious, yes, so always you need to have some curiosity. If you have the curiosity only, you have to learn more and more new things. So the curiosity is the underlying base which increases the new learning thoughts or the new learning. So if you have the curiosity only, you will find more. So your learning ability will be increased. Then collaborative. Yes, you need to work collaborative with other healthcare personnel, so your peers. And humble. Yes, you should be very kind and humble to all the people. All as a healthcare provider and as a healthcare professional, you need to be very humble. So these are some of the behaviors that you need to develop in order to be a inclusive individual in a particular team. So if you practice all those things, these are some of the outcomes that you may have. So these are the positive outcomes that you may have in a inclusive environment. Okay, so you can go through the tips and what are the inclusive behaviors. So are you all clear up to now? Or do you have any doubts? If you have any doubts, you can ask. So I think none of you have any doubt. So I'll move to the next part. I think this is the last part. So effects of discriminatory practices. So we studied what is this discrimination, what are the types of discrimination, and how the anti-discriminatory practices are imposed by the legislations and all those things we studied. And now today we'll see what are the effects of these discriminatory practices. So first one is marginalization. So marginalization means we are treating a particular person or a group of person as a insignificant. That means we are not treating that particular person as a similar like ourselves, like the transgender person or the homosexual, like lesbian or gay or the bisexual people or the transgender people. Normally we are not treating them as they are also human beings like ourselves. Okay, we are not treating them. So this is we are calling it as a marginalization. So this is one of the discriminative effect of the discriminative practice. So what is so normally all the discriminative practices will this marginalization, this empowerment leads to finally it will affect the health and wealth of the individual. Okay, so all the discriminative practice, the ultimate outcome or the consequence is the health improper or the it's the impact of the bad or the adverse effect of health and wealth of a particular individual. Then disempowerment. So disempowerment means, so once you start to discriminate the people, then each and every that particular person or a group of people, they starts to develop less power or less confidence among themselves. Okay, so this behavior eventually leads to more health issues because an individual may think devalued and depressed due to the disemployment. For example, I am telling that if you start to point out that a single mother can't raise up the child in a good manner, if you start to tell or if you start to criticize like this, eventually criticize like this, then the mother eventually starts to lose their power or the confidence. So she also may have some suspicious that, oh, I'm not well fit or I can't raise up my child as a single mother. So they starts to devalue means they won't value their power. Okay, so they start to devalue, and this devaluations causing the depression, and ultimately they can have both the physical, mental, psycho, all the effects. Okay, but it is not actual thing. So if the single mother is there, we needs to encourage her. So you can able to raise the child alone. So we are here to support you. Likewise, we need to provide some kind of courage and encouragement to the person. But this discrimination, what it is doing, we are disempowering the person or the group of person. So the next effect is low self-esteem and self-identity. So I already told you self-esteem means how an individual perceive himself or herself, like how I perceive myself. So that means I'm thinking that, okay, I'm a beautiful woman. I'm a lecturer. So I am living a wealthy life like that. I am having my own perception. But if someone starts to criticize me, so you are not beautiful, although you are a lecturer, you are not wealthy, you are not having enough amount of money or like that, those things, then I start to have some low self-esteem. That means I start to suspicious among my suspicious on my thoughts. I start, so I will tell that, oh, I am not beautiful that much. Or although I am a lecturer, I am not having that much of money. I am not having that much of knowledge. So am I not qualified to teach to other students? Likewise, I have some suspicious thoughts on myself. Okay. So why all those are happening? Due to this discrimination. So discrimination can lead to people losing their self-worth. Some risk group of people may have low self-esteem before they start using the health and social care services as well. Okay, so these discriminatory practices can eventually develop the low self-esteem, and this low self-esteem starts to prohibit or interrupt the usage of commonly available health and social services as well. A person with low self-esteem will develop the negative self-identity, which brings the feeling of worthlessness. They will feel like transgender people. If we start to discriminate themselves, then they will think that they are worthless, they are useless, they are not fit to live in this world. They are not worthy to live in this world. So they sometimes they ended up in they end their life. Uh, Sometimes they end their life as well. So this is one another effect due to this discriminative practice. And the other one is the restricted opportunities. Yes. So not all the people may have equal opportunities. So if they are not having equal opportunities, although they are having all the talent and abilities, they also start to strive there. So if they start to strive, it strive that effect strive first mentally, then it goes for the physical poor physical health. So these are the major impact or the adverse effects of discriminative practices. So the ultimate or the consequences, it is affecting the whole health of an individual. Then our final part is celebrating diversity. So we told that they are each and every person is diversity, and also we are discriminating the person depending on that diversity. So we are discriminating because he or she is, or a particular group is having that particular uniqueness. But although we are discriminating that, we are also celebrating that diversity. So what is the importance? So why we need to celebrate this diversity is, so here. So these are some of the importance of celebrating the diversity. Okay. So knowledge is the key to tolerance. To gain a new perspectives on the lives of others around you as well as the world. Yes. So if we celebrate the diversity only, we can have the knowledge and we can have the new perspectives of others. If you start to celebrate other people's culture, then you can gain some new perspectives, new ideas, new knowledge. So your thoughts and your own assumptions, your own beliefs regarding the particular culture could be changed. So it is one of the outcome for celebrating this diversity. Cultural celebration foster respect and open-mindedness for the other cultures. The same. So we can have the open mind, because each and so if you start to celebrate the diversity, then you can have the new understandings about one's own culture, and your previous assumptions and prejudice all will collapse, and you can change your thoughts as well. Celebrating our differences as well as our common interest helps unite and educate us. Yes. So although the diversity we are using for the discrimination, but once you understand the correct form of diversity through the proper education, it educate the different kinds of people. So the proper education regarding the diversity will educate the people. It won't discriminate anyone. To understand others' perspectives, to broaden our own, and to fully experience and educate. So our experiences, our knowledges could be broadened, and we can educate ourselves, and also we can educate our other people, and we can change the thoughts of other people as well once we get a fully understanding regarding this diversity. And in a world, it is a heritage. So world, it is a heritage. So the diversity, if there is no any diversity, Then there, so heritage means so the things that we are saving and we are keeping it as a very property. The property that we are saving, we are calling it as a heritage. So the diversity also, it's a like heritage that the world is having. People all around need to understand and learn to appreciate other cultures, and this is one way to accomplish this. Yes. So how we can accomplish this? How we can accomplish the celebrating the diversity? The thing is, we need to respect the diversity of other people, like cultural, economical, whatever the diversity. We need to respect one, and we need to appreciate, and we need to accept. So there are three parts. We need to respect, we need to accept, and we need to appreciate. So if we do the three things, there is no any discrimination. So that's how we can celebrate the diversity. Through each other's diversity, we become more aware of our own. Yes, so we are not having that much of knowledge regarding our diversity, but once you get to know, once you talk with other diversity only, we can have our uniqueness. Okay, so if one person is have any unique idea, then only we start to search whether in we also having that kind of or how what are the uniqueness that I am having among myself. So if he is doing like that, so can I able to do that, or can I able to do more than him? Likewise, we can explore ourselves. Not only do become more aware, we gain a sense of pride for the diversity of our own culture. Understanding people and their backgrounds is crucial to personal and the community growth as well. To see how many different forms of music can bring happiness to groups outside of their own traditional roots. Then, in order to realize what varied cultures, beliefs, and lifestyles people lead outside the somewhat heterogeneous bubble of Boone, in order to relate different social, economic, and educational backgrounds. To help us all spend some time together, we understand and appreciate each other's culture so much. So the major goal, or the major concept of this celebrating the diversity is, once we celebrate the diversity, we can develop ourselves. So through our development, we can develop the whole community. We can educate ourselves. We can have more knowledge, and also we can identify and we can explore the hidden abilities, the uniqueness among ourselves. So if we found out and if we explore all those things, we can develop ourselves. So if we develop ourselves and if we have a proper understanding, we can remove the improper myths and understanding of other people. We can make aware of them, other people also, and through that we can have a good understandable community. So, or by celebrating the diversity, eventually we can neglect or we can remove the discriminative activities undertaken by the society eventually. So this is why we need to celebrate the diversity. So normally in May 21st, the World Cultural Day of Diversity is celebrating by worldwide. Okay. So that is the end of today's session. So if you have any doubts, you can ask now and you can clarify it now. Or if you are not having any doubts and if you are all clear, then we can wind up the session.
In Sri Lanka also we can follow this practice.
Yes, we can follow this practice, but the thing is, all the people needs to follow that. Yeah, but yeah, one or two person can't change the whole thing. But if we understand all the that means if we have the proper knowledge and if we educate others also, like if we educate the public, then I think we can practice and we can celebrate it. But according to the Sri Lankan setup, I'm not sure. Any other doubts?
No.
Any other doubts? Others? If you need any clarification, you can ask. So if you are not having any doubt, shall we wind up the session?
Okay, ma'am.
Okay, so thank you everyone. So we'll meet in the next class. Okay, so bye.
Okay, bye.
Thank you.
Thank you very much.